Thank you, Mr. President. Let me begin by thanking Secretary General for his report, providing an insightful and informative update on the global fight against HIV/AIDS. While significant progress has been made in the fight against HIV/AIDS, challenges still remain in our way towards eliminating HIV/AIDS as a public health threat by 2030, a target set in SDG 3. Strong political leadership is most critical to address inequalities and gaps in AIDS epidemic response. During the COVID-19 pandemic, India took swift and timely action by involving communities, civil society, and development partners to mitigate the impact of COVID pandemic on HIV services. In India, the HIV and AIDS Prevention and Control Act 2017 provides a legal and enabling framework to safeguard the human rights of infected and affected populations. India's unique HIV prevention model is centered around the concept of social contracting, through which the targeted intervention program is implemented with support from civil society. The program is aimed at behavior change, communication, outreach, service delivery, counseling, and testing, and ensuring linkages to HIV care. India is providing free antiretroviral treatment to close to 1.6 million people. Indian drugs are also reaching millions of people living with HIV in Africa. Mr. President, India's National AIDS Control Program has been revised, revived, and revamped to focus on hard-to-reach and at-risk populations. We are gradually transitioning the people living with HIV to dolutegravir, a safer and efficacious antiretroviral medication regimen. Viral load testing facilities have been scaled up, and HIV counseling, testing, and community-based screening for early diagnosis have been ramped up to achieve the target of elimination of mother-to-child transmission of HIV. In 2021, the National AIDS Drug Control Program reached almost 8 million of high-risk and vulnerable population with a comprehensive package of targeted peer-led prevention services through revamped interventions. In the same period, more than 43.1 million HIV tests have been undertaken among high-risk groups, other vulnerable populations, and pregnant women. Communities have always been at the center of National AIDS Control Program response and considered equal partners. With key contributions including initiatives like community-based HIV screening and multi-month dispensation of antiretroviral drugs, we are ensuring uninterrupted delivery of services to the last mile. Mr. President, in India, the latest HIV estimates have revealed that the annual new HIV infections have declined by 46% between 2010 and 2021, signifying the tremendous impact of prevention efforts. Similarly, AIDS-related deaths have declined by almost 76.5% in the last decade. This indicates the remarkable impact of a very comprehensive and holistic national AIDS response. In 2021, there were around 1.6 million people living with HIV on antiretroviral treatment in the country. This is highest since the launch of antiretroviral treatment under National AIDS Control Program in 2004. People living with HIV are on most advanced lifelong free dolutegravir-based regimen, which significantly improves the quality of life. Mr. President, we have to achieve zero new transmission of HIV in order to deliver on the promise of ending AIDS in the next 10 years. We need to foresee and identify our challenges and gaps, customize our programs, share knowledge, and emulate best practices. Let me reiterate India's commitment to strengthen international cooperation in our common fight against HIV. India is ready to intensify cooperation with all partners, including WHO, to achieve the Sustainable Development Goal of ending HIV as a public health threat by 2030. I thank you.